I'm Michael Woodworth, and this video is the upper cervical forward head posture corrected exercises. So we're going to give you a few exercises to be done at home to increase your outcomes of treatment and also to give you the tools to keep you well so that you don't need treatment. Okay. First, many people in today's modern society have forward head posture. What that implies is that the head itself is forward of the supporting spinal column. Very common with anyone who sits at a desk or works for hours in front of them in an outreached hand position. What happens is you get a shortening of the front side of the neck, becomes shorter and tighter, pulls the head down by looking at our texting and computers, as well as working in front of you shortens up the pecs, and this can lead to a cross syndrome. And a cross syndrome is basically a short, tight structures here and short, tight muscular structures here at the base of the head. Because this forward head posture, we often need to reset our horizon line for our eyes to see, and we crunch the small muscles in the back of the head, and this leads to a lot of chronic neck tension and injury. People often say they feel soreness in the shoulders, and what it is the shoulders actually fighting against these short and tight pecs and sternocleidomastoid scalene muscles here that they're working all day and they're sore, but the problem is really here and here. So we're going to begin some home rehab for that. And the first thing we want to do is become aware of our head position during the day. And one of the things we share with you is to tuck your chin back and to see how far back your ears will come in relationship to your shoulders. It's important to realize that if you have forward shoulders, you might think that your ears and shoulders line up, but if the shoulders were actually back where they're supposed to be, and then the head comes back, you can see a marked difference in the alignment of the ear to the shoulder, which should actually sit over your hip. So the first exercise is going to be a basic chin tuck, and the chin tuck is going to put our hands behind our head. I'm not in any of these exercises pulling my head forward. I want to basically create resistance so that I can push my head back away from my nose into the hands, which are providing resistance, so I can strengthen the weak muscles on the back side of my neck and shoulders. So I'm going to go 1, 2, 3, relax, 1, 2, 3, relax, 1, 2, 3, relax. It's important for postural muscle training that you hold for 3 to 5 seconds, which is about a good breath and a half or 2 breaths, and that you don't reset the position, but you perform that sequence about 20 repetitions, 20 to 40 repetitions as you increase your endurance. Okay? Of course, like any of our exercises, if you find yourself doing these and they increase your pain or symptoms, we ask you to stop until we see you during your next visit. Besides working the central posterior aspect of the back, right, because you should feel the back of your neck firing, I want to work the lateral posterior and the other lateral posterior sides. So I'm going to turn my head to the side. I'm going to look over my knee. I'm sitting on a stool here with my feet firmly planted. And I'm going to take the same side hand, lining up my nose and my elbow, and I'm going to press away from my elbow. So if I were to remove my hand, my head would fall back like this. But I'm going to hold my head and resist this motion and press 1, 1,000, 2, 1,000, 3. I should feel this lateral backside of my neck tightening as it attempts to pull my head back. So once again, I'll do 20 to 40 repetitions, never pulling my head forward, just simply resisting my head's attempt to go back so I can strengthen that side. I'll turn my head to the left side, looking over my left knee, use my left elbow, line up with my nose, and go away from my elbow here, firing this side of my back. 1, 2, 3. Reset. 1, 2, 3. Reset. 1, 2, 3. The important thing about any of these exercises is to always keep the shoulders depressed or down and try to keep them back so that they too line up. Ears, shoulders over my hips and spine. A lot of chronic pain from postural distortions is due to your body trying to hold weight that is not being supported by your spine. Your spinal column should be a straight line by which all of your other tissues hang off of. So you shouldn't have to use muscles to hold your head in place or to hold your arms back. And it's that very practice of your body's adapting, trying to hold itself together, that causes a lot of chronic problems. The other things we can do for strengthening the neck would be to go side to side. We don't give these to everybody, it depends on your distortion. So if you've been given the side lateral flexion exercises, you'll simply hold your head, keeping the shoulder relaxed and depressed, and I will try to move my head ear to shoulder, and I'll simply resist that motion. 1, 1,000, 2, 1,000, 3. Relax. 1, 1,000, 2, 1,000, 3. Same thing on the other side. 1, 1,000, 2, 1,000, 3. 1, 1,000, 2, 1,000, 3.